Hey guys, Paul from Inside PA Training. I have a video for you today on a very interesting kind of interview format that is being used more and more for clinical kind of programs like PA schools and medical schools. You may have heard of it. It's called the MMI format. MMI stands for Mini Multiple Interview Format. It's also sometimes called the OSCE, O-S-C-E, which stands for Objective Structured Clinical Examination. Now basically what this is instead of doing an interview in front of a panel of representatives for an institution, you do a number of short and sweet little interview vignettes. And they're usually conducted in different rooms. Usually they have one faculty member per room. The MMI, the little mini multiple interviews, usually last somewhere between 5 and 7 minutes depending on the task. And you can have anywhere between 6 and 10 of them depending on how much time is used. Now, the reason they're moving to these in some institutions is because they want to see what you're able to do. It's one thing to read, what kind of experiences you've had, but the OSCE kind of and the MMI kind of help them to see how you think and how you actually behave in a situation similar to one that you might be put in as a physician assistant, applicant, student, that kind of thing. So there's big debate about whether these are better or worse, and I'll leave that up to you. I think they have their strengths and weaknesses, but it is something you should be prepared for. So first off, we'll talk about what kinds of scenarios you might encounter. Well, there are a number of them. Very typical format would be to walk into a room where you have an interaction with a patient. It would be obviously an actor portraying a patient. And generally you would read something about this scenario before you enter the room so you know what is going on, what you're tasked with. And then you go in and you act like you are a PA and you're dealing with that patient. And the patient actor has instructions about how to deal with you. And then it's usually a faculty member who is observing the interaction and they score you. The idea being that this is hopefully more objective. Everybody gets the same mini multiple interview stations. So if you sit down in an interview and you feel like, oh, I didn't really hit it off with that one person, they didn't seem to like me, it's a little more fair because you're going to see a number of different people and everybody's going to get that situation. Now, in addition to patient interaction stations, there are ethics stations. This would be where you read a scenario that has to do with an ethical situation, an ethical dilemma of some sort, or it could be about policy, healthcare changes, current events, that kind of thing. Typically, they're going to ask you a specific scenario there, and they're going to ask you to talk about it. There are a lot of ways to handle this, and we'll get to that in just a second. Now, next we have the writing sample. A lot of schools are going to this, and this is where they give you a question on paper, and then they give you a certain amount of time to formulate an essay response. The whole idea behind this is you can squeak through undergrad with good grades and still have limited command of the language, limited writing skills, and it also shows your clinical ability. So they might ask you a question about where do you see the future of healthcare going, or tell us about a time when you had a difficult interaction with somebody who was supervising you, something like that. They want to know how do you think, and then how can you communicate that in writing, what's your punctuation and your grammar like. It kind of helps to weed out some of the international school applicants who maybe don't have as strong English skills. Now, also peculiar to the MMI is often a team task, and this would be where you would go into a room. There might be other applicants there. Usually there'd be anywhere between 1 and 3 other applicants there. Together you read a task that you need to complete, and then you cooperate together to complete that task. And it might be as simple as, build a bridge from one table to another table using only these supplies given here, these blocks. It could be to formulate a policy statement about some sort of problem that the school is having. But the idea is that you do it collaboratively. As you know, physician assistants need to collaborate with all kinds of healthcare professionals, including physicians, and they want to know how you go about that. We'll talk about how you deal with that in just a minute. Now finally would be a discussion kind of MMI room, and this would be a room where you're given some information about a topic, and then you have a discussion with the faculty member in the room about it. They might ask you questions about your position. They might just want to hear what you make of it. They might say, what have you done to prepare for this program? Or What makes you think that we should admit you over another applicant? What are your strengths and you know, the real bullet points that make you exceptional? Now, there are different skills involved with each of these rooms. Often people who are interviewed in an MMI format find it kind of exhausting, so there may even be a room where you're given a break, a rest, just to kind of collect yourself. These tend to happen quickly, and you know, one of the reasons they do it is they can get a lot of kinds of information about all of the applicants in a short period of time because the faculty are split up rather than all being in one room listening to one candidate at a time. So, a couple of rules about how you approach an MMI situation in an interview. First off, you want to make sure and read the information that you're given carefully. Generally, they're going to have it on a piece of paper that's in a laminated, you know, plastic sheet protector, and you're going to read that. You're going to have a certain amount of time to read it, somewhere between, I don't know, 1 and 3 minutes, depending on the length of the task. And then you have a certain amount of time to actually go into the room and do what's expected of you. This is where knowing the instructions is critical, because obviously a lot of the time you're not going to be able to bring that instruction sheet in there with you. So you got to get clear on what they want right from the get-go. I always recommend that you take as much time as you're given to read the scenario and be very, very clear. Read it several times if you need to. Often they will not let you ask questions, but if they do, be sure and ask questions before you go in. Now, second of all, one of the principles of an MMI format interview is that in most scenarios there is no right or wrong answer to the question, and this can help you relieve your stress a little bit. Usually it's not so important that you get the right answer so much as you're able to describe your thought process. They really want to see how you think. For instance, in an ethical scenario, they want to know, is this applicant able to view both sides of the problem, or do they just have one sort of knee-jerk reaction about how to handle it? So, very important is that you understand there isn't necessarily a right answer, but you need to demonstrate your thought process. You need to kind of think out loud, and that's what I encourage people to do. Think out loud. You can even correct yourself as you go. You can say, well, if this were the case, then I think I would do this, but oh, that could lead to a problem here with this, so maybe how I would back up and handle that is, okay? You see how they can see your thought process in a very transparent manner, and it helps them to know what your critical thinking ability is. Now, on interactions with patients, very specific kinds of things you can do. Obviously, you're not going to know in advance what they're going to hit you with, what kind of question, but there are some things that are super important. Number one, definitely hear the patient out. Listen to the patient completely without interrupting for as long as 60 seconds. It may seem like forever, maybe even 90 seconds, because that's just the right thing to do. You want to make sure that the patient feels heard. Often these are kind of soft skills like interviewing skills. So you want to make sure that patient feels heard. So sit there and nod your head and listen carefully. Really hear them out before you speak. When you do finally speak, make sure and confirm with them what you're hearing. I hear that you're really upset because I'm running so late and you've been waiting and that frustrates you. Do I have that correctly? After you reflect to them what you're hearing, make sure and check it with them. And if you're right or wrong, they'll give you a little hint, hopefully. That helps them to feel heard, and it helps you to know that you're on the right page. Now finally, the most important rule with patient interactions is that the patient's welfare must come first. And this will be an issue when you get to ethical questions as well. If you're not sure how to handle an interaction, default to what is best for that patient. You can always disagree with the supervisor. You can always say that you're going to talk to the authorities, but you always want to think about what is in the best interests of the patient. Your job in medicine, ethically, the Hippocratic Oath specifies, first, do no harm, and second, do the most good, okay? Now, this brings me to ethical situations. I encourage you to read up on some of the really common ethical dilemmas that people are tasked with in interviews, and you can Google these online. There are tons of them. It could be a provider gives homeopathic medicine to patients who they don't believe are particularly sick for the sake of giving them something so that the patient feels that they have been treated, even though maybe the provider doesn't believe in that, okay? There also is the classic example of you have a child who has a very serious illness that will kill them if they don't receive treatment, but the only medicine that you can give them is in a pharmacy and it costs more money than you have. Would you consider stealing the medicine, or would you handle it some other way? Now, for these ethical dilemmas, it's more important than ever that they hear, one, your thought process, but two, they want to hear both sides of the ethical dilemma. And I always tell people, ethical dilemmas are a little bit like balancing scales. There are at least two different needs that are competing. Often they are the welfare of the patient versus what is the right thing to do for you clinically. Or it could be the welfare of one patient versus the welfare of the greater community. For example, if somebody tells you they're going to go and shoot somebody else, there are provisions in the confidentiality laws that allow you to share that information for the greater good. But it's important that you tell them what both sides are and what are the risks. On the one hand, this patient is in danger and I have a responsibility to get them some help. On the other hand, this patient is owed the courtesy of confidentiality, and that's really important. So I'm really torn between those two. Finally, in these ethical situations, if they ask you for an opinion, don't be afraid to give one. Again, these are not right or wrong questions. What they want to see is how you think about your answer. So tell them, I think this is a tough decision, but I would probably handle it this way, and here's why. And then don't be afraid to just kind of say, that's how I do it, and I think that's acceptable. You don't need to freak out and wonder if you got the right or wrong answer. Now finally, in discussion questions, the same thing applies. You want to make sure they understand your thought process. Typically, they're going to ask you a question about current events or your resume or experiences. And this is a time for you to have a collegial interaction with a faculty member. Don't stress over it. Tell them your opinion. Be willing to hear theirs. And think out loud again. These are steps that in an MMI will serve you well over and over again. Now, as I said, the MMI interview usually goes really quickly. You're going to be exhausted by the end of it. So try, as you leave each room, to let go of what you have just seen and done. If you feel like, wow, I just really botched that one, say, that's okay. That's only 1/6 or 10th of this interview. I need to let that go and put it aside. Try and, I tell people, try and think of all of the emotions and feelings you have around an interview process like a tray of ice cubes. Each one is its own distinct piece, and as soon as you leave that room, compartmentalize it, put it aside so that you can concentrate on doing a good job on the next one. If you walk around kicking yourself about how you did on the last one, your performance is really going to falter on the next one. So anyway, that's MMI interviews. There's plenty more to it, obviously. I encourage you to Google MMI interview format online. Some of the schools actually publish some sample questions to give you an idea of what you're up against. This is generally something that if you are an outgoing, conversational person, you're going to do well with. If you're a little more introverted and quiet, you're going to need to practice these, and I encourage you to practice in front of video and people that you trust. Anyway, good luck with MMI interview format. Let me know how you did, and leave some comments here in the thread so we can see what you encountered and how it went for you. Thanks.